I'm Amy Brainer. I'm in Women and Gender Studies and LGBTQ Studies. And I'm going to organize my comments around 3 very short conversations. The first is one that I put in the abstract for this talk. Self-care is the new pull yourself up by your bootstraps. I wrote that this simple statement is a smart critique. It points out the commercialization of self-care, the stratification of mental health services, and the fact that people are often blamed for their own mental health outcomes. This critique, I think, is well covered by other folks on this roundtable. The second conversation occurred at a conference I recently attended. The panel was about queer survival, and the last paper on the panel was about queer mentoring, something personally very close to my heart. The conference was in Mexico City, and the paper was in Spanish with interpreters on site. Many students from the local universities attended. During the Q&A, one of the students raised his hand and said, paraphrasing in translation, "Going to school has been so difficult. My experiences in the university have been so painful. Finding you," indicating his queer classmates and teacher who was present, "changed everything. It is you who have kept me here." As queer people, we understand that here does not just mean in this room or in this university. In many cases, it means in this world. The student began to cry. Soon, a majority of people in the room were crying. Many went on to share similar things. The third conversation was at the Chancellor's Luncheon with our recent guest speaker, Dr. Desmond Patton. We talked about the essential work that mentoring provides, especially for Black faculty and other faculty and students of color. At one point, I said something like, "There's no place to put that in the portal." For students who haven't had the pleasure, by portal, I mean the place where faculty delineate our accomplishments at the end of the year, highlighting especially grants, research papers, and other scholarly activities. I kept thinking about this after lunch. What in fact would go in the portal? Certain aspects of mentoring can be highlighted, but community is not a metric. I thought about my experiences of community on campus. As long as the withdrawal of family support remains common for LGBTQ people, we will continue to stand in for absent kin. How should I quantify these requests? Will you help me do my taxes? Can I just sit in your office sometimes with you and do my homework there? I think I'm being discriminated against at work. What should I do? I left home last night. I might need somewhere else to live. Do I include only the hours we spend talking in person? What about the hours washing dishes and lying awake at night thinking of ways to meet someone's needs? The daily messages to say, "How are you holding up?" This is not measurable. You can't put love in an annual report. And yet this is what sustains us. And I really mean us. This is not unidirectional support from faculty and staff to students. I too am part of this community. I too check the mental health boxes that keep getting associated with us on paper. I know how it feels to sit in the emergency waiting room, to sign in under surveillance at a low-budget inpatient mental health center, attending a loved one through another preempted exit strategy. I know the slow, grinding halt of depression on a cellular level and just how much work it takes to decide to live. I also know the joy of us. I, too, feel better when there is another queer person in the room, the feeling of home their presence brings. Queer culture is a home-making culture. Our lineage is one of adoption. And so this love is not limited to people under the endlessly proliferating acronym. Anyone whose family is not there, whose value is not recognized, is part of this community I'm talking about. I recently wrote a chapter on queer families of origin and choice under the conditions of social distancing and lockdown. The chapter delves into these conditions here at UM-Dearborn. It is also global in scope, and I looked at the evidence emerging from many cultures and places. What I found were hundreds of testimonies of care. Queer people sharing housing and food, attending each other through sickness, grieving deaths, providing support as larger numbers of people than usual were outed to family members and harassed or assaulted by them, visiting one another in jails and prisons, providing legal representation under conditions of state violence. Emotional labor was also important. Across every indicator, age, gender, class, race, religion, the desire to be with other queer people was palpably strong. So strong, it surprised even me. As I wrote in the chapter, finding other queers is not a luxury, it's a life skill. In class next week, my students and I will read an article by Ina Micheli titled Self-Care, an Act of Political Warfare or a Neoliberal Trap. In this article, the author analyzes the ways that self-care has been privatized and depoliticized, the bootstraps model, if you will. But she doesn't leave us there, nor does she believe that this model of care and well-being has to be the dominant one. She traces clearly the origins of self-care in African, indigenous, and other women of color organizing. There is in this activism an intergenerational precedent for care as a collective responsibility. Sharing the burdens of everyday life is inextricable from movements to end state-sponsored violence or change the society in some larger way. I want to end with an observation that is itself a whole talk, or maybe many talks. I hope it provides some food for thought. The literature is absolutely abundantly clear that connections to each other are necessary for mental, emotional, spiritual, and physical health. Given such, we need to think very, very carefully about the choice to put someone out of community. I'm not talking about a blanket critique of cancel culture, holding public figures accountable for their actions, for instance. I'm talking on a very internal family level, the communities we make on this campus. Choosing to remove someone or exclude someone or even overlook someone is not a small thing, given what we know about the life-affirming role that community plays. We can ask ourselves, who on our campus has access to community support and who doesn't? How can we make our love for one another more expansive and less conditional? And I'll end there. It's abrupt, but I think sometimes abrupt is good. I hope the question nags us all a bit, and we can return to it in conversations with each other after this roundtable is over.